Hi, my name is Nicole Migliaro, or Nikki. I am in SPCE 680, Section 809, Instructor Thomas Mulderink, and today's date is 10/4/2024. I have my timer here, which I am setting for 1 minute. This is my deck of cards. I am going to shuffle 3 times. Okay, cutting the deck of cards in half, putting these there. Okay, starting my timer now. Oh wait, I'm sorry. Adjustment and notable objects, pica. The brain disease, epilepsy. Ritualistic behavior. Comorbid conditions. Here's what a model evokes. Motor imitation. Seeing behavior. To use to discover and understand why behavior occurs. 3-term contingencies. A range of strategies used in the process of determining motivation and instruction for the behavior. FBA. Involuntary word phrases if someone else says echolalia. That's my timer. Putting that over there. This is my pile of cards that I did with the 1 minute timer. Include the determination of whether the resource is feasibility. Behavior analysis. Collaborate with others to improve the service of their clients and compromise when faced with conflict. Collaborating with colleagues. A mental health condition in which the person is unable to speak in certain social situations, often attributed to fear or anxiety. Selective mutism. How long a behavior occurs, that is duration. Sans Wesley, well, fast minute every day, shuffled, staff meds. And one person purposely coordinates his or her focus of attention with that or another person, joint attention. Everything the person is currently capable of repertoire. Behavior analysis infused diversity relating training and their supervision. This one is pass. Incorporating and addressing diversity. Put that wrong one over there. Individual who receives the treatment target client. Inability to perform purposeful actions such as simple movements or speech. Apraxia. Structured method utilized for identifying highly preferred items or actions that can be used as reinforcers to keep motivated people time when teaching. Reference assessment. Behaviors that inflict harm on one person admitting the behavior, SIB. The number of responses per unit of time or frequency divided by the unit of time rate. A change in behavior, learning. Disability that affects the acquisition of knowledge and skills characterized as average IQ and deficient in adaptive skill functioning, intellectual disabilities. The proportion of a population found to have a particular condition at a specific time. This one is temporal. Proportion of population found to have. No, this one's prevalence. behavior maintained by consequences operative behavior. Includes all forms of communication within the oral speech that are used to express thoughts, needs, wants, and ideas. Augmentative, alternative communications. Categories of behaviors that are characterized by the strong preference for sameness, frequent repetition patterns, restrictive repetition, repetitive behavior. Typically includes an analysis on the quality, quantity, and consistency of the literature related to either. This one is systematic review. Shall prescriptive in a particular situation, event, or activity, which includes specific information about what to expect and situations, and why these descriptions also include visual images. This one is social stories. Standardized interview that helps diagnose autism spectrum disorder in children and adults. Autism diagnostic interview. Neurological and developmental disorder characterized by social communication skill, the presence of restricted patterns of behavior, object of speech, symptom begin early in the developmental period and cause clinical and significant distress. Autism spectrum disorder. 6 minutes, okay. Representative descriptive of the literature by professional qualified to examine the research based these reviews. This one is narrative reviews. Determining what the cause of the behavior actually is. Testable behavior. A standardized observational assessment tool that helps diagnose autism spectrum disorder, ASD, in children. This one is ADOS. Autism diagnostic observational scale. Behaviors change directly contact and contingencies. Rule govern behavior. The overall account of a specific bit of behavior, the number of times a behavior occurs, frequency. Okay, getting my second deck of cards. The process of differentiating between two or more conditions which share similar signs or symptoms. Differential diagnosis. An observable and measurable action or behavior, a response. A communication system based on applied behavior analysis that uses pictures to help people communicate. Difficulty is a form of AAC, PECS. A behavior analysis collect, represent, and analysis data accurately to make decisions about the client's care, collecting and using data. Property represent the elapsed time of a response or how long, temporal extent. Subject attitudes, feelings, and other constructs that attempt to use internal factors to explain behaviors, mentalism. The range of differences in individuals' brain function and behavioral traits regarded as a part of a normal variation in the human population, neurodiversities. Represents the accuracy with which the intervention of independent variable is implemented. Treatment integrity. A standardized system used to code diseases and medical conditions, ICD. It's a national classification of diseases. Pretend play, often called imaginative, symbolic, or dramatic play, involves children using their imagination to create scenarios, rules, and narratives that may not involve real objects or actions. Imaginative play. Behavior analysis referring documents the referral for their clients if they suspect that medical or biological variables impact client behavior, needing medical considering medical needs. 10 minutes. Okay. This property represents when the behavior occurs with latency as the measure. Temporal focus. A way to describe behavior by typography, what it looks like, or its function. This one is operational definitions. Compromise of the following input space. Interview relevant client barriers and stakeholders, lender barriers, treatment options, implementation, planning, and monitoring. This one is pass. Treatment selection process. A person's condition with regard to their psychological and emotional well-being should inform mental health. A research method where a small number of participants are evaluated. Carefully control conditions to monitor behavior over time. This one is single case design. The number of new cases per person a year incidence. Extent to a treatment is fair, reasonable, appropriate, unintrusive, likely to be recommended to others. Treatment acceptability. A means of assessing the validity of theory regarding the causes of a disorder and the facet of a disorder based on the fact that causes always precedes effect. This one is primary criterion. The time between the onset of some environmental event and the target response. The time between the onset of some environment event and the target response. Pass. Latency. I knew that. The American Psychiatric Association provides a reference book used to aid diagnosis of mental health and brain-related conditions, DSM-5. The set of observable characters of an individual resulting from the interaction of its genotype with the environment, phenotype. Solicit support from others and create natural content for the behavior, social support. A chemical compound used to treat or cure illnesses, medication. Okay, I got 1, 2, 3, 4, 5, 6, 7, 8 for the 1 minute, and I got 1, 2, 3, 4, 5 wrong.